Yeah,
Go ahead.
my question was how is the Canadian vaccine situation in Canada?
Well, the vaccine started in, I think, late December. We vaccinated less than 1% of the population.
Already started in December.
Yeah, I think late December they started vaccinating people. The federal government basically gave the provinces. Canada has 10 provinces, and each province, like Ontario or Quebec, have a fair amount of authority. And so the federal government, what they do is they distribute the vaccines to each province, not completely on a per capita basis, but kind of on a per capita basis. And then they leave it to the premiers of each province to decide who gets vaccinated. Most of the premiers...
Who gets vaccinated?
Yeah, who gets vaccinated first. So there's a schedule of phase 1, phase 2, phase 3, phase 4. And some provinces are doing it differently, but basically the focus, especially in Ontario where we live, the phase 1 focus was to give vaccinations to everybody in long-term care homes.
So old people
homes,
means.
Yeah, and the workers there. And that's been done that. Everyone in the long-term care home has been vaccinated in Ontario. Some people refused it.
That is because of the doubting.
Yeah, that's right. Yeah, they doubt the effectiveness. We have some anti-vaxxers in Canada, but not many. We're not like the States or Britain. But there are a few people who are against vaccines. Only the Pfizer and the Moderna vaccines have been approved. One of the things Canada did is we took out options to buy more vaccines per capita than I think any other country in the world. With all the options we took out, we have enough to vaccinate 9 times the population, I think, of Canada. And the idea was that what we'll do is
giving to moose.
Yeah, that's right. Yeah, there was a joke about that. Enough vaccines for every person and every moose in Canada, and maybe every deer. But the idea to do that was to make sure that, because there was of course uncertainty about which vaccines are going to work, which vaccines get approved. And so the federal government said, we'll just cover all the bets. We'll just take options to buy from everyone who was working on creating a vaccine. And then the idea is with the surplus that we have is to basically give those for free. At least that's my understanding.
For free to whom?
For people in developing countries like in Africa and things like that. There has been a delay shortage. Everybody is a little bit concerned about what's happening in the EU because that's where we get the Pfizer vaccines from. They're produced in Belgium. And our contract is to have Pfizer vaccines that are being manufactured in Belgium rather than in the States. The States, Pfizer does have manufacturing capability for the vaccine in the States. But from my understanding, our contract is with to receive the vaccines from the factory in Belgium. And now the EU is thinking about putting export restrictions on Pfizer.
To secure their EU number.
That's right. Yeah. To put the priority on that, the people in the EU get vaccinated first. That's the key thing. Another priority from the federal government, we have 10 provinces, but we have territories. Yukon, Northwest Territory, and forgive me, but I'm not sure how to pronounce the third one because that territory was created when I was not living in Canada.
Oh, really? That's new?
It's a relatively new one. And of course, the federal government has more jurisdiction over the territories than they do of the provinces. So one of the things the federal government did is they put a huge priority on making sure that people in remote indigenous communities get vaccinated because it's really spread. They did a very good job of keeping the virus out, but once it gets in, it spreads really quickly in these indigenous communities. So a priority has been on vaccinating these people as well. So that's basically the vaccine situation.
And so at this moment, so what is the plan for people living in Ottawa for vaccination?
Well, again, Ottawa is a city, so we come under the provincial jurisdiction of who gets vaccinated. first. In Ottawa, everybody has been vaccinated in long-term care homes who want to be vaccinated. The government in Ontario was a little bit slow in distribution and setting up vaccination sites, but they seem to have worked that out a little bit better because nobody wants vaccines sitting on a shelf. Vaccines don't prevent the virus. Vaccinations prevent the virus, and vaccination that hasn't been injected into somebody has no impact at all. The federal government is saying that by September, everyone who wants a vaccination in Canada will be able to receive one. And that's just based on the orders that we have with Pfizer and Moderna. I think the government will fast track the Novavax and the Johnson & Johnson, as well as maybe the AstraZeneca ones. Hopefully this month, by the end of February, those will get approved. And that will hopefully speed up the process.
But at this moment, what you said was before was Johnson, Pfizer and Moderna vaccine was a shortage, right?
Well, basically the Pfizer one, and again, this getting back to what I was saying, is our orders are from the Belgium manufacturing plant for Pfizer, and what Pfizer has done is they either shut down that plant for retooling or they reduce capability, production capability to kind of retool the factory so they could, in the long term, produce many more vaccinations per month than on their existing lines. So there is going to be a delay. My understanding is that the contracts that we have with these vaccine companies is they have to guarantee a certain number of doses by the end of each quarter.
Each quarter.
Yeah. Okay.
Means
within a 3-month period. And so the vaccinations that we're hoping to receive in the first month or the second month of this quarter are not going to come until hopefully the last month of the quarter. That's the assurances that the federal government. Yeah, I think it's supposed to be in March. And then we'll be kind of ramping up the production not the distribution and the vaccinations and whatnot.
So while we are waiting for the vaccine from the Pfizer and Moderna, can we get the vaccine from Johnson &
No,
Johnson?
because Health Canada hasn't approved those.
So after.
Yeah. They just basically, I think Johnson & Johnson just announced their results of last week. And I think the time period from when Pfizer announced their third stage trials to approval from the government took about a month, I think. And so based on that, hopefully by the end of February, Health Canada will approve these vaccines for distribution in Canada.
February means this month already, right?
Yeah, the end of February.
I know.
Hopefully.
Within this month, Johnson & Johnson vaccine will be approved.
But compared to America and the UK, Canada takes a little bit longer to approve the vaccines. The UK and US approved the Pfizer vaccine faster than Canada did.
So Johnson & Johnson vaccine also can be delayed a little bit to approve?
Well, again, I think what it was is I think the UK approved the Pfizer and the AstraZeneca vaccines just like in a matter of 1 or 2 weeks. Not 1 week, but maybe 2 weeks after they produced their data. Canada, I think, will take about a month.
More cautious.
Yeah, we're more cautious here.
So after Johnson & Johnson vaccine approved, can we get the one immediately?
Yeah, I don't know the details on the delivery dates for those vaccines. Everything right now is one good thing about, even though Canada we've done a better job than Western Europe and America, but that's not really saying much. But one thing the federal government has done is they've been a little bit cautious and not overselling or over-promising the Canadian public. America did that. Trump said several months ago that 100 million people or something would be vaccinated by the end of the year. Yeah, it's not true. So it gave false hope. So the federal government's not even talking about the Johnson & Johnson or the AstraZeneca vaccines. Their timeline is only based on the vaccines that have been approved, which are the Moderna and the Pfizer vaccines, and based on the contracts with those two companies, that the government is saying that everybody who wants a vaccine will receive a vaccine by the end of September.
End of September.
Yeah.
So that's good to know.
Yeah, and then anything else is just kind of icing on the cake.
What did icing on the cake?
Well, an extra benefit. So if the Johnson & Johnson and the Novavax and the AstraZeneca vaccines get approved, then that will just hopefully speed up the process later. The Johnson & Johnson and the AstraZeneca vaccines don't have the same efficacy as the Pfizer and the Moderna ones have. But if you look at that data, those two vaccines, even if you get COVID, you just seem to have mild or no symptoms at all, which is the most important thing.
Yeah.
Is to not end up in hospital from COVID. Of course, the first thing is to not catch it. But if you do catch it, you don't want to become really sick.
But Johnson & Johnson vaccine can prevent those things.
Serious illness.
Can prevent to fall into the serious illness.
That's right. It seems that when they did the third stage trials, even though around 30% of people who received the vaccine, well, I can't say 30% who received it, but the people who did catch COVID after being vaccinated, no one became seriously ill. And that's the most important
thing. Yeah, that is the most important thing.
That's the most important thing.
Okay, thanks very much.
That's it?
That's it.
Okay.